Hi, Dr. Leonette. I want to give you a quick overview for the Enliven patients of what we do in the Alpha Emerge with the epigenetics program. First, we start off with the swab. This is a big important part. With this, we actually do a swab on the inside of the cheeks. It gets packaged and sent off to our company that measures the array. From that, it measures about 500 different SNPs or snippets of your DNA material. With that information, you will get back a series of ones and zeros in a report. With that information, I am able to interpret and upload it into a report, form up a really nice report. And I'm actually going to show you an example of that. There's a lot of things we look at. One of the key things is always it's nutrition and supplementation. There's also athletic performance, sleep, detoxification abilities. And I always like running the comprehensive programs. That way we have a good idea of where you are and the best way to express your genomics. So you can see here, we can look at hunger, satiety. I'm not going to go through all these, but I just want to give you an overview. Your propensity for insulin resistance, if you can handle dairy or not, gluten sensitivity. A lot of people think that they're gluten sensitive, but in reality, they might be grain sensitive or glutamic acid sensitive. So it's one of the things we look at, your propensity for sweetness and how you actually have a perception for that, what the optimal type of carbohydrates will be for you, fats. And a lot of people ask about dietary fats and cholesterol, and if your body can tolerate saturated fats, poly, mono, and what is the ideal type of fats that should be in your diet. With protein, the ratio of protein that you should be looking at in relation to carbohydrates or fats. Basically, should you be a vegetarian? Not. Your metabolism, what your normal resting metabolic rate would be. And then from that, actually would work up a macronutrient worksheet, which would tell you how many carbohydrates, proteins, fats to eat. It can give you some recommendations on that based off of what your genetics would recommend. Part of this also, we're going to look at supplementation needs. So while I'm not looking particularly at this with this program with your blood work, I am able to cross correlate your labs with your epigenetic data. That's what we get detailed in more at the Alpha Emerge program here. We can look at different vitamins, vitamin A, some selenium, magnesium, choline, vitamin C, D, K, folate. There's a lot of different things that we're looking at here. And from that, it allows me to give you some clean recommendations on the best way to optimize your epigenetic expression. Basically, this means we're going as far upstream in the system as we can possibly go to help you achieve optimal wellness and optimal health. It goes hand in hand with your chiropractic or wellness care. It's just a way that you can get more clarity with what your body would use the most and have the best benefits with. This is always one of my favorite things to talk about, caffeine. If you guys are in the office, you see I drink a lot of coffee, but if you have high metabolism and low anxiety risk, and you have certain factors here, then you're fine drinking coffee and caffeine a little bit more. And as you can see, we have some food lists here with some recommendations. We have some example sleep. This is actually a good one to look at with onset propensity, how long it takes you from when you hit the pillow to when you should go to sleep. Should we have disruption, narcolepsy risk, restless leg. We also here is an example of the detoxification abilities. So you can see here, we can look at different pathways. There's the methylation pathways. This is important. This tells you if your body can actually read your genetic material appropriately. Acetylation, glutathione, which are some of your detoxification pathways. What we're going to look at for mitochondrial health, mold sensitivity, especially around West Virginia, it's a big thing. Lyme disease, which are risk for actually, if you got bit, actually developing Lyme disease, how your body would handle endotoxins and pollutions, histamine, so we can kind of dictate what foods would be best for you. If you have mercury, the impact of that with certain types of fish, what kind of fish to avoid, what would be best. This also go into some athletic performance. We're looking at VO2 max. I can actually outline based off of the VO2 max and your metabolic rates, recovery, fatigability. There's your recovery. Strength and hypertrophy, we can actually build you a plan to maximize your time in the gym. So if you have any more, if you have any questions, please contact me. Please contact Tina. We're happy to explain that to you. And if you're going to do the program, we'd love to hear from you. And just check out here on the website or contact Tina and she'll get you arranged. All right. Look forward to working with you.